Dr. Kiran Mashundar Shah, Principal Secretary Mr. Gaurav Gupta, colleagues, thank Gayatri and Dr. Sharachandra for asking me to share my thoughts on startups. I have 10 minutes to share my thoughts with you. I'll be very brief. Um, I do believe that the startup movement has received a lot of fillip. Started with the IT sector, it's catching up with the biotech. The Department of Biotechnology started this BIRAC, Biotechnology Industry Research Assistance Council. So I chair all these technical committees, so I have a fair experience. Now you have a whole channel for, starting from Ignition Grant, you have SIBRI, you have BIPP, you have Contract Research Scheme. And recently our state announced a similar program similar to Ignition Grant, which is not surprising because of the proactive nature which the state has always been functioned when it came to science and technology. But the point I want to tell you today, evaluation is terms of TRL, Translational Readiness Level, which is graded from 1 to 9. If you are in basic research starting, you are evaluated as 1 and 2. If you are ready for commercialization, you are at TRL 9 or whatever. My own perception is, with all the systems that are available, you may be able to reach TRL 6 or 7. There are 2 points I want to make here. One is, if there are 200 projects of startups with BIRAC, we have looked at 5 times more projects. The success rate is less than 20%. And I'm sure the state government would also end up with the state success rate. This does not mean, in my opinion, the other projects are useless. There are many others who are probably must be getting into this. So I want to appeal. The 2 initiatives of the center or the state would not be adequate for more startup funds available. The mechanisms need to be worked out. The government alone cannot do this. There has to be public-private, whatever systems must be available for them to get into Ignition Grant. The other end of the spectrum, I also feel is a problem. There are a lot of people who are closer to commercialization. They have this problem. So where is this facility for pilot plant? Where do I do my clinical trial? Where do I do my field trials? So we also need to think of the stage has come. There are 60 products that have come out of about 600 projects supported by BIRAC, 60 products. Now, many of them have gone through very difficult times. So one of the concerns with startups have is, what do I do when I reach that stage? Of course, they are trying to get the angels around, the guys who can venture around. I do not know where we are in those systems. Sometimes I'm tired of listening to panel discussions on how to get funding and things like that. Whether they really reach these people, have any progress has been made, I do not know. At this point of time, I can only appeal to our own government again, also think at the other end. I was talking to Dr. Vijayaraghavan, secretary, he said, definitely there are some systems now will be shortly in place where funds will be available for commercialization also. He has with Wellcome Trust a few systems that are evolving, some 1,000 crore money coming from somewhere. I wish he were here, he would have told you about what is it available today for commercialization. Therefore, my plea is we really need to have support system both in early stage as well as at the late stage. Because we have reached that stage, there are many of these people are ready, if not by, they have gone through the SIBRI, BIPP, CRS systems, and they are asking, I have not been able to get angel funding, I have not been able to get venture funding, what do I do? I still think they need a hand-holding, in my opinion. The second point I want to make is, where should the startups be? I do think there are 4 ecosystems in which these startups should be. One is in an academic environment, whether it is IIC, whether it is IBAB, whether it is CSR labs, PPT labs, all these are all, I would put them academic, basic research is going on. I do believe all of them should have startups. There should be startups in medical institutions. Can our Rajiv Gandhi University in Bangalore think of startups? Can St. John's think of startups? The third category is big pharma. Why not big pharma have startups? Big pharma have so many things going on. Ideas may come back and forth. The last category I would think is startups in agriculture universities. To my mind, one thing what is happening today is we are setting up incubators. And incubators have these startups. Many times I find they are standalone. I meet a lot of people who come to me for advice. I'm not an expert in so many areas. So what do I tell them? I just say, at least I know the people whom they can contact. What I'm trying to tell, if they are in an appropriate ecosystem, definitely I think the projects also will be dovetailed to that. The drug thing, let me tell you the statistics. Of all the projects, successful projects, 60% are in the health area. After 600 projects, 60% are in health area. Of these projects, products that have come out, again 60% are in health related, mostly in devices and diagnostics. I was a bit surprised that we have made so much progress in devices. It is amazing kind of talent that we have in terms of making devices. I imagine if these startups are in a medical environment, they will get a lot of help. Otherwise, many times they do not know. They develop the product. They are not very much aware of the clinical trial. Does my device, does it need trial or not? Of course, sometimes even DCGI is not clear whether it is coming in their purview or not purview. These are issues. And I also want to tell you the kind of projects that are just sampling. Devices, diagnostic, handheld, sensors, biomaterials have come in a very big way. People are talking about implants. And at the other end, people are also looking at nutraceuticals. People are also looking at biomass conversion to energy and various kinds of products. And, of course, Sharath highlighted what can be done with this thinking like making a diet for a PKU child. I had some contact. I chaired the RC of CFTRI, and I told them, why don't you make a phenylalanine deficient diet? They said, it's not a big deal for us. We will make it overnight, they said. They did make it, but then who is going to validate it? Who is going to establish consistency? To validate that this diet really works in a fetal category patient, how long it takes? What are all the parameters you need? I feel there are tremendous amount of challenges in my opinion. So many areas you can choose. Of course, there are always people who will come with their own thoughts. Definitely, yes, you have to pursue your passion, all right. There is no doubt about it. But at the same time, I feel you look for the right ecosystem. Somehow I feel that I may differing from majority view here, because to my mind, startup is looked upon as a revenue model. I would like all these big institutions, CSAR labs, big labs, they are huge labs. DBT labs, DST labs, all one lab. I have seen startups, they require only 1 or 2 workbenches with 5 or 6 people, at least for the first 2 years. To my mind, the big institutions should allot a laboratory for startups and give them space at a concessional rate, give them access to equipment at concessional rate. Many times they have told me, sir, you say you have given us ignition grant. Most of it is going for paying rent and accessing equipment. I don't think, what I do believe the return must be when they succeed, you have an equity or whatever. My thought process is very different. I'm not able to convince a lot of people. When they say 100 square feet should cost this much, I don't agree with that. It should be free in my opinion. Of course, it can't be free. If you have visited these institutions, including IISc, including DBT institutions, DST institutions, CSR institutions, huge labs, you name the infrastructure, they have it. Why cannot have startups right in the institution? I don't know, this thought process, I thought Dr. Vijayaraghavan will be there, I will tell once again, but this is something we need to think seriously. And the return from startups should come when they succeed, and you have an equity, 5% equity, 10% equity. I don't think they will mind it at all, in my opinion. Well, I told you about all the projects possible, but I am biased. I will also tell you what you should not be doing. the first thing I will not do is to drug discovery. I want to discover a drug for cancer. My PI3 kinase, GPCR is my target. You remember, 50% of the drugs in the market are GPCR targets. That is why I feel if you are in the ecosystem of a big pharma, they must be doing this kind of thing. And the fallout of this, you know where to go. It may be repurposing a drug. It may be repurposing a failed drug. That is where the ecosystem will help, in my opinion, if you are in a big pharma environment. Similarly, each environment will help you, in my opinion. Otherwise, okay, incubators are okay, you have it, that it goes, they pay rent, etc. This goes on all right. But somehow I feel many of them feel let alone, alone. They are lonely, in my opinion. They don't have real mentorship that is available to them. There is one other interesting thought I have. In my experience of these 9 or 10 years, I have seen projects coming from unorganized sector. I want to tell you about 2 examples. One is a guy, so I think middle Tamil Nadu, where there's a large of plantain farming. He goes to the pseudo stem and makes fiber out of that and gives job to 30 other women who are not educated. And he makes beautiful leather bags, out of plantain fiber, and gives it to all the ladies. They are very impressed there when he gives all those purses and this. There's another guy who has developed a machine where he can link up these fibers so that you have long fiber and so that they can make fabrics. There's another guy who is using poultry, fish waste, which people will not touch. He has made use of illiterate or people who are not gone through formal education. He makes dog biscuits from bone, and he makes beautiful leather equivalent to fish leather he makes with various products. These are not people whom we will be able to catch. They will not be applying to us. Is there some mechanism? Of course, they need help. They need some mentoring. They need some science into what they are doing. But is it possible to get them into the mainstream? It is not jugaad. They are very smart people. But they can't speak English. I'm saying this because after looking at IPL. Look at IPL, how many young guys who have come. Yesterday I saw some guy was bowling. Sir, his father is a daily laborer, they said. Somebody said that. There's a huge opportunity that is available in this country. There are a lot of people educated, not formally educated. Is there a mechanism available for them to bring them into the startup machinery? So, just to summarize what I'm trying to tell you, funds are an issue. I have made an appeal, but don't get bogged down. Funds will be available, but you have to fight it out. It's not an easy system. Sitting here and advising you is very easy for us, but it's not easy. But I can tell you, those who are stuck with this, hold on to this, you are able to get the funding. We have examples where they have had venture funding, they have had angel funding, but it is still a small percentage. But it doesn't matter. I still want to appeal to the government that you need help even at a later stage, not only at the earlier stage. The second point I'm making is ecosystem is important. To my mind, if the startups are in appropriate ecosystems, and there are 4 ecosystems which I say, if you are there, you will be greatly benefited. And the choice of the project is very important. Don't say I'm going to discover a drug. Don't say I'm going to do genome sequencing. Genome sequencing, let the big brother do. They will come with mutations and pass on the mutations to you. You work on those mutations. You do PCR amplification and say, does this correlate with this disease? But if you start genome sequencing yourself, you will be nowhere, in my opinion. You will be spending all the money paying for sequencing. That's what will happen. So, many possibilities are there. The time is very exciting. So many of you have great ideas, starry-eyed, you think this can be done, that can be done. When you get into it, you may be depressed. It's not as rosy as I thought, but it doesn't matter. And in a group, in a proper ecosystem, you will succeed. And I wish you all the very best. Thank you.
Thanks very much, Professor GP. So I thank all the speakers for their kind, wise, forward-looking remarks. As a token of our regard, we would like to present each speaker with a couple of books. May I request Tanushree, yeah, come on over. Nazmia, present Principal Secretary. This is our student Nazmia. Yeah. To Kiran Mazumdar. Sure. Yeah, you can present. Thank you. To Professor Vijay Chandru. To Professor Vijay Chandru, over there.